In the age of rapid technological advancement, it's alarming that the safety guidelines regulating electromagnetic fields and radio frequency radiation are still based on research and standards developed over a quarter century ago. This reliance on outdated safety measures persists despite mounting evidence from significant studies suggesting serious health risks associated with everyday levels of EMF exposure. Current EMF regulations are primarily based on the Federal Communications Commission's standards set in 1996, which consider only thermal effects, the heating of tissue. This criterion is starkly outdated. Since then, a plethora of studies, including those by the Interphone Hardle Group, Serenat, and notably the US National Toxicology Program, have documented potential health risks far beyond mere thermal effects. These studies have shown associations between EMF exposure and increased risks of cancer, genetic damage, and neurological disorders, among others. The Ramazzini Institute study extended these findings by observing similar cancerous effects from RF exposure levels as low as those emitted by cell phones, underscoring the potential dangers of long-term exposure. Furthermore, the Reflex Project and the Comprehensive Bioinitiative Report have compiled substantial evidence of biological effects occurring at non-thermal levels. Ignoring the signs? Despite these alarming signals, there has been a puzzling cessation in proactive research and review of existing guidelines. The NTP's findings of clear evidence of cancer in animals exposed to RF radiation should have been a clarion call for further investigation and action. Yet, not only has there been no significant movement to update the safety standards in response to these findings, but there has also been a reduction in funding for continued research in this area. This halt in funding and research occurred even after a landmark federal court ruling in 2021, which criticized the FCC for ignoring scientific evidence and failing to justify its determination that its regulations protect the public adequately. This situation points to a dire need for a regulatory overhaul. Safety standards must be revised to reflect the latest scientific findings, including the potential non-thermal effects of EMF exposure. It's imperative to consider the nuanced ways in which RF radiation interacts with biological systems, effects that extend far beyond heating. For instance, the FDA-approved Therabionic treatment, which utilizes RF radiation to treat liver cancer, effectively demonstrates that RF radiation can influence cellular and molecular mechanisms in beneficial ways, a principle that could have adverse counterparts. Perhaps most concerning is the specific vulnerability of children to RF radiation, which has been widely acknowledged, including by the American Academy of Pediatrics. Kids are not only more susceptible to potential hazards due to their developing tissues, but will also endure longer lifetime exposures. As such, it's crucial that updated guidelines prioritize protections tailored to their needs. It is both irresponsible and dangerous to continue relying on outdated guidelines while ignoring contemporary scientific evidence and halting further research. As technology continues to evolve and become even more integrated into our daily lives, so too should our understanding and regulations of its potential impacts on health. We owe it to current and future generations to ensure that our safety standards are robust, reflective of the best available science, and routinely updated to mitigate any risks associated with EMF exposure.